And we're ready. Okay, so we're gonna continue now with medications for the ear, and we're gonna basically emphasize otitis, inflammation of the ear. So it will be a quick PowerPoint, and we're gonna start with acute otitis media. This is inflammation or fluid in the middle ear. Patients gonna complain about otalgia, ear pain. Kids usually they'll tug or hold their ear that it hurts. They'll try something to minimize the pain, so they'll start playing with the ear. Causes can be bacterial, can be viral, can be both at the same time. And usually the background is they have an infection in the pharynx. In order to make the diagnosis of otitis media, the patient must have acute onset, recent symptoms of inflammation of the middle ear effusion, that means swelling, and middle ear inflammation. So the treatment usually, is going to involve an NSAID or a steroid glucocorticoid and antibiotics. 80%, a high number of them resolve without any antibiotics. So if we're gonna use antibiotics, the most common drug that we use is amoxicillin. Again, it's a penicillin. And regarding amoxicillin, besides some medication that is PO, what is the adverse effects, NVD, nausea, vomiting, diarrhea. If the patient is allergic to amoxicillin, he's gonna be allergic to what else? And we have mentioned many times cephalosporins, or they can make the question backwards. The patient is allergic to cephalosporins. Do you think it's a good idea to provide amoxicillin? So regarding penicillin, those are the questions that they'll be asking you. Is for some reason this is a recurrent infection? Now we can use a combination of two antibiotics. The most common one are amoxicillin with clavulanate acid, amoxiclav. That will be the brand name, amoxiclav. Regarding the prevention of otitis media on kids and toddlers, is the breastfeeding for at least 6 months, and that's because breast milk has antibiotics that help fight this type of infections on kids. Prevent daycares where most of the kids they have some type of respiratory infection. Very hard to do. Eliminate people that smoke around that kid. Reduce the use of pacifiers after 6 months of age. And the thing is, pacifiers it alters the normal movement of the pharynx. So instead of pushing things down, it's going to push it up into the nasopharynx, and it can push bacteria into the middle ear. Otitis media, it can be prevented with vaccination against influenza, if we're talking a viral infection, and vaccination against Streptococcus pneumonia in case of a bacteria. Both of them are part of the chart record in most states here in the States. If the patient has recurrent otitis media, that means that they have 2 or more infections within 6 months or more than 4 infections within 12 months, then we need to provide antibiotic therapy. Same thing, 7 to 10 days. And prophylactic. Prophylactic means to prevent. And regarding prophylactic antibacterial therapy, usually this one lasts longer. Obviously, the dose of the antibiotic is not as strong as the short-term antibacterial therapy, but this type of patient will require prophylactic antibiotics to prevent reinfections of the middle ear. The other one, it will be make sure that the patient is up to date with their shots and the placement of tubes to the membranic tympani. That way we make sure that this tube allowed any bacteria or viruses that get stuck in the middle ear to move forward into the external auditory canal, go out the ear. If we see otitis media with effusion with a lot of fluid, it can cause a mild hearing loss because the tympanic membrane is so tense that it's not gonna move. Usually, this type of inflammation, swelling, doesn't require antibiotics. So we basically provide NSAIDs. The other type of otitis is the otitis externa. This is inflammation of the external part of the ear. That means basically the upper part of the ear and the auditory canal. And usually, it's abrasion and excessive moisture will happens that will make this type of inflammation. Regarding infections of the external part of the ear, usually fluoroquinolones. This is antibiotic. Fluoroquinolones is very common to be used, or fluoroquinolones with steroid. So we have an antibiotic with an steroid, or it can be ciprofloxacin and hydrocortisone. Same thing, antibiotic with a steroid. Regarding the steroids, we already talked about them a few times in different chapters. We're going to ask you, okay, what happens if this medication gets absorbed by the body? Then we're going to talk about hyperglycemia. We're going to talk about hypertension, and we're going to talk about immune suppression. Regarding antibiotics, only that what happens if the patient is allergic to it? Well, then we go to another antibiotic. We switch to another one. So regarding antibiotics in the adult, ciprofloxacin is the most common one used, and in children is cephalexin. Cephalexin is a cephalosporin. So I'll put it right here. So the way you can identify a cephalosporin is because all of them, they start with ceph. That's how you can identify them, ceph. So cephalexin is a cephalosporin. Regarding question that they may ask you, so if the patient is allergic to cephalexin, this patient is also allergic to penicillins, and vice versa. If the patient is allergic to penicillins, then it's allergic to cephalosporin. Regarding fluoroquinolones, the adverse effects is tender rupture in young patients. So fluoroquinolones, they're not advised to be given on pediatric patients. The Achilles tendon is the most common one that ruptures. Regarding otitis externa prevention, make sure that the ear's always dry. Don't use Q-tips that much. Don't push anything in, or try to clean deep. Do not remove earwax or force the removal of earwax that is deep or close to the tympanic membrane. And do not use earplugs unless you're swimming. This is a very rare condition, necrotizing otitis externa. This is where the tissue dies. And basically, we're going to see it a lot with diabetic patients. And same thing as the feet, they lost sensation of the ear, so they got a cut, they don't know about it. There's an infection coming in, and until they can smell it, or they can start feeling the pus coming out from the infection, that's when they are aware that something's going on. And unfortunately, by that time, the tissue dies very fast because it's cartilage. We don't have a lot of blood flow here. So this type of tissue is very easy to necrotize, to die. The most common type of antibiotics are what we call the Pseudomonas drugs. Pseudomonas is a bacteria that is very common on tissues that are humid. Pseudomonas is a bacteria that is very common on tissues that are humid. And if this patient, has an ear canal that is always moist, Pseudomonas can grow easily. The medications for Pseudomonas, ciprofloxacin, antibiotic. Fungal otitis externa or otomycosis, very rare. but the most common cause is candida. And Aspergillus candida is thrush, like the one we see on the mouth. And same thing is because the ear canal is very moist, and that produces favors the growth of a fungal. The treatment is flutimazole. It's an antifungal. In this case, drops, but we have also creams. You're gonna see it for fungal infections of the feet. So clotrimazole is a antifungal. In this case, the presentation is ear drops in order to fight the infection. Regarding eardrops, they're gonna ask you the technique. Sorry, common question. How do you modify the ear to make sure that the eardrops go all the way down the ear canal? Regarding kids younger than 2 years of age, you pull down and back. Regarding older kids, teenagers, adults, you pull up and back. So the way I remember this is basically, a 2-year-old is always moving around, they're all over the place. You tell them stay there, you turn around and you turn back to see your kid and it's nowhere to be found. So you tell them, hey, calm down. So you pull down the ear. That's what I remember with kids. Calm down, pull down. And with teenagers and adults, at least regarding my grandma, every time I misbehave, she'll pull my ear up as a punishment. So that's how I remember that every time I misbehave as a teenager, my grandma will pull my ear up. Okay, so that's basically it for this chapter. Thank you for your attention, and I'll be seeing you soon.